We've got some case studies we're going to work on, and this is to help prepare you for possible questions on the HESI. This is chapters 4 and 5. So we're not talking about pregnancy anymore. We're finished. Okay. So let's look at this first one. And what this is similar to a next gen question, right? That you might see on the HESI as far as options to fill in. So go ahead and read it, and then we're going to answer the question on the next slide. Okay. Well, darn it. I forgot to erase the answer. I've got the answers marked. Darn it. So an important step to prevent human papillomavirus, which is HPV, right, is to receive a series of vaccinations. Do you know what that vaccination is called?
Is it the Gardasil?
Gardasil, yes. So we can give it as young as 9 years old up to 45 years old. I think your book probably still says 25, but it can be given, and usually the older you are, the more doses you need. So if we give it young,
दोस्तों आज के ज़माने को देखते हुए ही मुझे लगता है कि रिलीजन के ऊपर वीडियोस बनाना जरूरी है क्योंकि
Okay, Sam, you've got something else going on in your room. I muted you. Okay. And so herpes simplex is a virus sexually acquired that can't be cured. It's a virus, and it resides in the nerve endings in certain parts of the body. And then it's very contagious, especially when there's an outbreak. And those outbreaks are called vesicles. They're fluid filled. They're very painful. And when a male or a female has vesicles, this is when they're able to shed that virus to a partner. Okay. I'm gonna stop my sharing my screen so I can see what the next one is. So I can erase my answer, the answers. Sorry. Okay. All right. So for this next one, let's see. 4 and 5 are bacterial infections that can be transmitted through sexual contact. So under number 4, which one is a bacterial?
Gonorrhea.
Yeah, gonorrhea. So now I can do my yellows. Okay. And then which one under 5 is considered a bacterial infection?
Chlamydia.
Yes. So it's very important that you protect yourself and your partner by using what to prevent transmission? Condoms. Good. The next one is a nurse providing education again to a sorority on a campus. Okay, and this is for a class on reproductive health and the menstrual cycle. Okay. All right. So the first day of menstruation is designated as what day of the cycle?
1.
Day 1. Yeah, that's when we call the cycle. So day 1 of the period through until the next period starts. It's called the cycle. Okay. The average duration of menstrual flow is what?
7.
7 days. The average length of a menstrual cycle from day 1 to the next day 1 is how long?
28.
28. Now, some women have shorter periods, some have longer. Okay. The average length of the menstrual cycle is how long? What, we didn't do that. The average, let's see, is 2. The average length of the menstrual cycle is 3 days. Oh, number 3. I'm sorry. Without ovulation occurring about what day?
14.
14. I have, these confuse me. It should be A, B, and C. All right. So the middle part of the menstrual cycle, around day 14, is when a woman is most likely to be fertile, okay, and pregnant. Important hormones involved in the menstrual cycle include what?
Progesterone and the estrogen.
The progesterone here, and then the estrogen. Yes. Where is the point of the cycle that progesterone and estrogen levels are the lowest? Does anybody know?
At the beginning?
Yeah,
At
right
the-
before the period. Right before the period.
Right before.
Yeah, right before the period. Okay. So this is an NCLEX question. So an effective relief measure for primary dysmenorrhea. Do you know what dysmenorrhea means?
Painful administration or difficult.
Yeah, yeah. So relief measure kind of tells you that it's probably some kind of discomfort. Yeah. What would you recommend? There's more than one answer, I think, here. Let's see. Nope, there's only one answer.
C.
Nope, it's not C.
Is it B?
It's B. So what are prostaglandin synthesis inhibitors? Can you guess?
Stops prostaglandin production? Or inhibits it?
Okay. So NSAIDs. Okay. So when a client is beginning to start her period bleeding, she might have some dysmenorrhea, and that dysmenorrhea is caused by prostaglandins. Okay, it causes reduced blood flow to the uterus, and it hurts. Okay, so I always recommend naproxen or naproxen, a brand name Aleve is a good choice, and then ibuprofen. Those are called prostaglandin synthesis inhibitors or antiprostaglandins. Okay. None of those other things are really actually increasing activity helps improve blood flow to the uterus. Okay. The rest of them are insignificant or ineffective. Okay. Self-care instructions for a woman following a modified radical discectomy or mastectomy would include what? Can you see the notes at the bottom?
Expect an increase.
Yeah, this one here. Expect a decrease in the sensation or tingling in her affected arm as her body heals. A modified radical mastectomy means they're taking out some of the lymph nodes, and that causes that arm on that side to become edematous. It's called lymphadenopathy, extra lymph liquid fluid, because if you remove the lymph nodes, the lymph has nowhere to go. So sometimes we can send a woman to physical therapy for that. Okay. When providing care to a young single woman just diagnosed with acute pelvic inflammatory disease, your book says to position the woman in the semi-Fowler's position. Pelvic inflammatory disease is multiple bacteria found in the genital tract, okay, of a woman. It can be very serious. And we have several medications that we use to treat her. And it depends how bad it is. When we look at the white blood cells, does she have a fever, things like that. If we keep her in the hospital for a 24-hour period, give her some hefty antibiotics, and then sending her home on some oral antibiotics. Sometimes it says, explain to the woman that infertility is likely an outcome. No, it is very possible if she has frequent PID or pelvic inflammatory disease. If she has it more than twice a year, that she might become infertile because of scar tissue, but it's not likely. Okay. So the Center for the CDC now has changed its medication regimen for PID. Okay. Or I'm sorry, for chlamydia. We used to treat chlamydia with azithromycin, but now we have to use a broader spectrum antibiotic, and that's doxycycline. Because chlamydia is resistant now to azithromycin. It didn't always used to be like this. But when you give a particular bacteria the same antibiotic year after year, years after years, it can become resistant, and we have to change antibiotics. And we've changed it now to doxycycline. Pelvic inflammatory disease might include chlamydia and gonorrhea and bacterial vaginosis and E. coli. Usually pelvic inflammatory disease, there's a lot of different ones, and it becomes very serious. Chlamydia is a very common sexually transmitted infection, and it's kind of scary because it does travel quickly from tissue to tissue. If we have a client that comes in and she's pregnant and we do a vaginal culture at that first visit and she has chlamydia, we need to treat it now. And then in a month, we're going to make sure she doesn't have it. The next month, we're going to culture her again. So have to stay ahead of it. And we have to be educating our clients about chlamydia. Chlamydia can cause infertility because it spreads so quickly and can cause scar tissue. What symptom described by a woman is characteristic of premenstrual syndrome? Premenstrual syndrome.
The first one.
Yeah. Feeling irritable, moody a week before a period starts, premenstrual. Okay. Hormone levels are low. And so not only is it the feeling of irritability and moody because of the hormone levels, but there's some physical things that come with that too. Bloating, just weight gain, feeling awful. Okay. Amenorrhea. I gave you 2 slide sets plus this one. So this is on your announcement, week 9 now. Amenorrhea, not having a period, missing a period, or not having a period for a whole year. Okay, depends on the setting. Okay, so diagnosis, if we diagnose a young woman with amenorrhea, she hasn't had a period for a year. Okay, we know that amenorrhea could be the result of a very athletic woman. Okay, excessive exercise or stress, okay, can cause amenorrhea. And it doesn't necessarily go away on its own. Okay, dysfunctional uterine bleeding, also known as abnormal uterine bleeding. Yes, it usually occurs in middle age. And it can be caused by anovulation. In other words, she's not ovulating, so sometimes she has irregular periods. Okay. Which health risk is not associated with menopause? Your book says one thing and I said another thing. Which health risk is not associated with menopause?
Breast cancer?
Yeah, it's breast cancer. Hang on just a minute. All right. Endometriosis. And I have some really good pictures in the slide sets I gave you of performing surgery, and it shows you realistically what endometriosis looks like in the pelvic cul-de-sac, you might say. Endometriosis is an outgrowth of the endometrial lining within the uterus. It actually escapes the uterus, okay? And it's found outside, and ovaries might be covered with endometrial implants, they call it, okay? So if you're counseling a client who has endometriosis, how do we manage it? Which ones are true about endometriosis? Endometriosis is extremely painful. It is not diagnosed officially until we actually see it in surgery. There's no test, there's no CAT scan or anything like that that can diagnose endometriosis. So how do we manage it?
C.
Yes, so this is a drug that we use to reduce estrogen's release. Okay, it reduces the estrogen levels, which help reduce the endometriosis. What else?
Would C be one?
Yes. Oftentimes we do have to go in there and we have to, and we call it fulgrate or burn those little implants inside, because it's those little bloody implants from the endometrium that are causing the pain. So we can go in there and remove them by burning them. Okay.
Would E be one?
Yes. If she wants to, if she has pain and she wants a future pregnancy, we can give her NSAIDs. Hypoestrogenism, low levels of estrogen is what we see in menopause, right? And beginning menopause is when we begin to, especially if there's a family history of osteoporosis, there is some bone loss during that period of a woman's life. And that's why it's recommended that a woman in menopause and later take extra calcium and vitamin D. So this is an answer as well. Okay. I don't think your book says this last one. Okay. We're going to take that one off of there. Women without pain who do not want to become pregnant need no treatment. Well, that's not necessarily true. They might need treatment because it's going to eventually cause pain. Okay. So, okay. So some other things that we need to teach young teens, okay, about sexual health and taking care of themselves, and about genital tract infection prevention is some other things other than sexually transmitted diseases. What are some things we want to teach her?
E.
D.
Why is D an answer?
Because doesn't the sugar help yeast grow, right? Something like that.
Absolutely right. So if you have a diabetic client, they're already prone to infections, right? Whether they're pregnant or not, they're prone to infections because of the high levels of glucose. And so they tend to have yeast infections. Okay. What else? Anything else?
E.
Yeah, we don't want her to douche because you're removing the good flora. A lactobacillus is a natural bacteria of the vaginal flora, and it's a good bacteria, so it destroys some of the bad bacteria. If she's douching all the time, she's destroying the lactobacillus. Whoops. And then this one. Okay. No floral scented bath salts. No fragrances in a bathtub if she's going to take baths. And we really do want her to wear cotton. Cotton has natural ventilation. Okay,
I'm
absorbs
gonna say, aren't they
moisture.
more breathable?
Yeah, breathable. Yeah. Mhm. Yeah. Okay. Let's go on to chapter 5. So you have a 28-year-old who wants to discuss contraceptive options. What are her options? She's in a committed relationship. I'm assuming that's monogamous, and wants to hear about different methods to prevent pregnancy. So when you do your assessment and you get her blood pressure, her pulse, she has a history of asthma and she's allergic to latex. She wants to use a method that she can control independent of her partner. Okay. She had a pap test 18 months ago and it was normal. Body mass index is 24 and that's normal. She does want to become pregnant again, but not for another 4 or 5 years. And she really doesn't want to use estrogen. She has migraines. Okay, so she doesn't want to use estrogen, but she wants something very reliable. Okay, so let me check my next slide here, make sure I didn't. Nope, I didn't. Okay. Let's see here. All right. So, which ones do we think we want to talk to her about? Combined oral contraceptive. You know what that is? You might not know what that is. Does anybody know what is meant by a combined?
Is it just like multiple
Mix.
contraceptives?
It's an oral, it's a pill form, okay, and it's combined. In other words, it has estrogen and progesterone in it. Okay. So it has estrogen and progesterone in it. A male condom. So would that be a good one? Estrogen and progesterone, according to what she asked for?
No.
Yeah, she said she didn't want any estrogen products. Okay. What about a male condom?
She's allergic to latex, so if it's latex free.
Okay. And she said she wanted something that she could control, right? Independent of the partner. Okay. Bilateral tubal ligation. Is that an option?
It could be, but you'd have to have it reversed and it's not as likely to work after.
She wanted more she wanted children, so we can't sterilize her permanently. Okay. Does that make sense? Bilateral tubal ligation is a permanent sterilization where we go in and the fallopian tubes, we clamp them. Okay. So that's permanent. Even though it can be reversed, she wants to have children in 4 or 5 years. We don't want to permanently sterilize her. Okay. What about a hormonal IUD? Would that work for her?
No.
Why
They have
not?
the non-hormonal ones though.
Yes, there are. What do you know what it's called?
It's the copper IUD.
It's
I
called
have
a
like,
Paragard.
yeah.
Yeah, it's
there's-
a copper IUD. Yes, but a hormonal one has progesterone, but no estrogen.
And that's the next one on, right? Or am I crazy?
Just a minute. So we could do either one of the IUDs. Okay. We're getting to that one. Okay. Fertility awareness method is not super reliable unless she's very disciplined. Okay. Contraceptive implant.
I
And
was
that's
just kidding. That's what the next one on is. I was
that's the
thinking wrong
next one
title.
on. And it's progestin only. Okay, I didn't spell that right. progestin, my goodness, pro only. Yeah, progestin. So we could do that. We could recommend that. Okay. Contraceptive sponge, not as reliable. Okay. So we've got this one we can do. We've got this one. Either one of these would work. Okay. Injectable progestin. It's pretty reliable.
Isn't that the depot
Okay.
shot?
The depot shot, the Depo Provera. That's the brand name.
Has really bad side effects though.
Weight gain, but it works well for, certain populations of people. The vaginal contraceptive ring, it's called NuvaRing, and it just stays in the vagina for 3 weeks in a row. It has estrogen and progesterone or progestin, whatever you want to put. Okay, so that wouldn't be a good one for her. And then coitus interruptus is not reliable because men can leak sperm even if they haven't ejaculated. Okay. All right. Based on your client's assessment data and preferences noted above, the nurse proceeds to teach the client about the contraceptive options she has. There are several types of hormonal IUDs. Some of the main advantages of this method are that they are highly reliable and blank. So let's go to the next one. So number one, IUDs, hormonal IUDs are
Would
very
be reversible?
reliable. Reversible, yeah, we'll just take them out. They actually are inserted into the uterus in the office. We have a device that I use that it goes into the uterus and it releases the implant. And then there's a string that hangs out the cervix so that we can pull it out when she's ready to have it replaced or she wants to get pregnant. And the nice thing about the IUD, hormonal IUD, which is my favorite to recommend because it's safe for everybody and it's appropriate for everybody at any age, is that once we remove it, usually they can get pregnant in the next month. There's no delay like there is with the Depo injection. Okay, so they do contain the hormone progesterone, yeah, progesterone, which prevents pregnancy. Okay, the contraceptive implant that goes right here, it goes in the upper arm. Okay, it's also a device that actually will shoot it into the arm. Okay, it's like a large needle, probably like a 12 14 gauge needle. And within that needle is the implant. And so when you inject it, it pushes that implant in the arm. I usually numb up the arm first before I do that. And it's good for 3 years. And it's called the Nexplanon is the brand name. So, and it's progestin only. So the injectable progestin, Depo-Provera, is an intramuscular or subcutaneous injection. Depends on the vial. So you have to read the vial. And you must receive it, or the client must receive it how often?
12.
12 weeks.
Yeah. So every 3 months, we're going to give her a new injection. Okay. Case study number 4. So you've educated your client and she returns to the clinic 2 weeks later and she has a hormonal IUD inserted by the nurse practitioner. Okay. After insertion, the nurse provides teaching to the client, hopefully before, and then reinforce it after. So what do we need to teach her? Let me make sure I erase this. Okay. I did it. Okay. What do we need to teach her? What's indicated, contraindicated, or just not essential? Okay. It's important. We put the IUD in her uterus, right? And I said there were strings hanging out her cervix, and we usually let them hang out about an inch so that she can check them herself. So we do want her to check after a menstrual period or every once in a while. So the answer to this one is yes, indicated. Be sure to remove the IUD after each incidence of vaginal intercourse. Is that indicated, contraindicated, or non-essential?
Contraindicated.
Yeah. If she takes it out, she's going to get pregnant. So no, it stays in. The IUD will prevent pregnancy, but it will not prevent transmission of sexually transmitted infections. Do you have any questions about how to protect yourself from STIs?
Indicated.
Yeah. Yep. By the way, if she gets an infection and she has an IUD, it could really be bad. The calendar-based method of contraception requires that women keep track of the number of days in each menstrual cycle.
Yes.
Does she need to know that?
I would think so.
She's using a different method though. She's
was
not
gonna-
using a calendar base. Yeah.
I was gonna say for her personally, no, but if somebody was using that, then yes, they would need to know that information.
Yeah. So once we put an IUD in within the month, we usually tell women to protect themselves. Actually, they're not supposed to have intercourse for at least a week. Okay. After that, they should be good to go. There's no delay in protection. Okay. All right. Semen analysis is a common diagnostic procedure related to infertility. When we do a semen analysis, it tells us the number of semen in a volume, the ability of the semen to move, their motility, their shape, the quality of the semen. Okay. In instructing a male patient regarding this test, the nurse would instruct him to what?
Is it the first one?
Doesn't need to be sterile.
Oh, it's B, isn't it? Because you need to have like a full count of them.
Mhm. So if a male has intercourse, then if he has intercourse the following day, there's not as many sperm. Okay. So we usually have a man be not ejaculate for at least 2 to 5 days before we collect an ejaculate. Okay. Because we want as many sperm that's normally available. Okay. If we're instructing a couple about fertility, we instruct them not to have intercourse every day. Okay. They need to skip a few days and so that there's plenty of sperm. Okay. Now you're evaluating after teaching a male client about using a condom. I can tell you, I never taught any male about a condom. You know, they figured out some other way, I guess. But I never taught one. So which one's correct? Oh, no, which one's not correct? the nurse would recognize the need for further instruction if the patient states that which one indicates that the patient needs more education?
Is it the first one?
Yes. Yep. That kind of spermicide with that non-oxynol 9 will actually cause the condom to allow permeation. In other words, it's not reliable if you use that kind of spermicide in a condom. This one I didn't know. A woman inquires about herbal alternative methods for improving fertility, but your book talks about this. So which herbal remedy to avoid while trying to conceive? Licorice root, lavender, fennel, sage, and thyme. I don't know why. I suppose if you're taking in a lot of those herbs, it might prevent fertility. It's just in your book. So FSH, follicle stimulating hormone, is a hormone coming from the pituitary gland, and it reaches the ovary, and it tells the ovary to spit out estrogen. Okay. Are you driving, Thomas? Yes, he's driving.
Yes, I am. Sorry about that.
You can't drive and be on Zoom. Okay, so you need to get off Zoom. Okay.
Okay, thank you.
For your
Well,
own safety.
I'm gonna park. I had to pick my niece up from the bus stop because it's raining over here really bad. So I'm just going to the head of my apartment, to the entrance of my apartment, but I park here, so because I don't want to
Okay.
miss unless you're gonna let me excuse.
Okay. So FSH is sometimes one of those hormones, along with HCG, that we give to clients that are trying to ovulate if they're having trouble with infertility. Okay. And it's intramuscular. Most of those drugs are that they use. So a woman is using basal body temperature as a method of contraception. She calls a clinic and tells her nurse, my period is due in a few days and my temperature has not gone up. Usually during the menstrual cycle, after she has her period and then ovulation about day 14, her body temperature actually goes up when she ovulates. And she's telling the client that she probably hasn't ovulated then. Okay. All right. So I didn't know this. A male client asked the nurse why it's better to purchase condoms that are not lubricated with non-oxynol 9. And the answer is, does not provide protection against sexually transmitted infections as originally thought. And they've also noticed the increase in HIV with those kinds of condoms, with that kind of spermicide in it. So a diaphragm is a non-hormonal device that is placed in the vagina. Okay. And what we recommend is that she put some spermicidal foam in it and then put it in her vagina, and it covers the cervix. Okay, it protects or not protects it, it prevents sperm from getting to the cervix. Okay, so we have to actually measure a woman and order it. It's a prescription. And then we have to instruct her how to put it in and how to remove it. Okay, so selecting all that apply when we teach about it. Which ones do you think are correct?
B.
Mineral, avoid using mineral. Yeah, you don't want to use mineral oil in it. Okay, that's one.
D.
D. Yep, we need to wash it.
C and E.
Not E. We don't need to put cornstarch on it, just air dry. Well, actually, let's see what it says here. It does say dusting of cornstarch is after drying the diaphragm. Huh. Yeah, you're right. And directing it down below the cervix so it'll go behind the cervix. So in order to put it, and then we also can grab with her, she can grab with her finger the edge, the rim, because it has a rim on it, and the diaphragm itself. And you can look at, I have pictures on my PowerPoint. So those are all correct. Okay. And then the last one is discharge instructions after tubal ligation should include when we clamp the tubes, it doesn't affect hormone levels. It doesn't affect periods. It doesn't do anything but make her infertile. Okay. So not expecting change in sexual function may enjoy sex more with their partner, knowing that they can't get pregnant. Using condoms is still very important to prevent sexually transmitted infections. Okay. Once those tubes are ligated, she can't get pregnant. So there's no delay in infertility. Okay. In other words, she doesn't have to wait a month for it to be effective. Whereas when a man has a vasectomy, you have to wait until the sperm count is below a certain amount or gone before you can safely have intercourse without condoms. Okay. So that was a lot. And some of the, obviously, I haven't read the book completely. But you can pretty much rely on those slides for those chapters. Okay. Any questions?